Going to begin by treating the frontalis muscle. In your trail guides for the body, you can look at each one of these muscles, see exactly where they are, where they originate, where they insert, the movements, so on. To do the frontalis, you put your fingers right over the eyes and just press down and hold. You can move just a tiny bit up and down. You may feel a spasm, especially if the person is having severe headaches. And you don't drag on the skin. You're just holding onto the skin is moving with you, and you're pressing into the muscle beneath it. Work your way all the way from the eyebrows all the way up to the line of the hair. And then move out a little bit. As you start moving out, you're going to be moving into the temporalis muscle. Temporalis, you'll do the exact same thing. You'll just come to the top of the cheekbone, press in and hold. You'll feel if there's any spasms. And this one, there's frequently spasms here, especially if a person's having headaches. So you'll just press and hold, and then release. Move just a fraction, press and hold again. At no time do you slide on the skin. When you do need to move, you're just going to pick your fingers up and move to the next point. When a person is having the mask of pain that goes across their eyes, then you can be doing orbicularis. And the orbicularis oculi is right around the eye. So you're going to go right to where the eyeball is and press up into the bone right above the eye. And you just press and hold. You're going to be going enough into the eyeball that you're going to feel the eyeball with your fingers, but just you'll know where to stop. And use enough pressure. If you're not using enough pressure, you're not going to release the lactic acid out of the muscle. You're actually not so much here on the face, but looking to get to the deeper muscles. Obviously here on the face they're all surface. Then you can just move to the outside of the eye, and again you just press and hold, and then a little bit toward the bottom of the eye. And just work your way around. This one is very good for anybody who's having a headache that's in this area. The next muscle that we're going to do is the occipitals. Now the occipitals are down at the base of the skull, right about where the hairline is. So right about here. What we're going to do, I like to work with the head straight down, but find where the occipitals are with your fingers, and then put your client's head down and press in. What I find, I don't particularly like having the client's head turned while I'm doing it. I think it's more comfortable for them if they're just relaxed straight, but only work on one side at a time, because otherwise it's just too painful for them. And again, remember to press in. What you're doing is you press and you hold for 30 to 60 seconds, and then release. When you're releasing, you're allowing blood to come into the area, and right away the muscle starts to relax. And then you press again, and you just press and hold. The suboccipitals, all in the same area. Now, if you look closely at my hand, I'm going to turn Debbie's head just so that you'll be able to see. My fingers are here. They're moving slightly. But you'll notice that the skin is coming with me, so that you're working deep on the muscle, But again, you're not sliding on the skin. And then you can move just a fraction. And like I said, I have the head turned face up. I'm just doing this so that you can see it a little clearer. And then just press and hold. If you find a spasm, just put your finger onto it and hold still. I'm going to move to the masseter. Now the masseter is a huge muscle for anybody who has TMJ. I always tell people if you chew gum, there's a real good chance you're going to get TMJ because you're using this muscle constantly, over and over and over. It's repetitive strain injury of the masseter muscle. There's a lot of other reasons not to chew gum, but this is a good enough one. So you're going to find the muscle, and when you look at the trail guide for the body, you'll see exactly where the muscle is. Most spasms you're going to find are going to be right up about here or here, but you do the whole muscle anyway. And you just put your finger on, and you're going to do the same thing. You're going to slide back and forth just to be able to find it. And when you find, you'll feel it. There's going to be a difference in the tension in the muscle. It's like a thickness in the muscle. And once you find it, you press and hold. Now if you're working with somebody who has TMJ, you're going to go back and forth and back and forth. Don't do both sides at the same time. It's just too painful. But you work on one side and you hold it for about 30 seconds. Then you let go gradually of the pressure, and then you press in on the other side. And you hold it for about 30 seconds. And then you come off. And you're going to cover the entire masseter the same way. Sometimes you'll find something and it'll feel like a long, the muscle's going this way and it's going to be a long strip going this way. And when you press on it, your client is going to know that you've hit the spasm. And so you just hold it. Always stay within your client's tolerance level. What I always tell my clients is that they have control of this. So they can just tell me if it's too much and I'll back off. Right? But on the other hand, you don't want to go so light that you don't treat the muscle. So you are going to need to be using some pressure. Okay? And then when you're finished with the masseter, you just move it around a little bit. If a person has TMJ, after you've finished working both sides and you've flushed it out a little bit, go back and press, and then ask your client to slowly open their mouth all the way. You're still pressing on the muscle while your client has their mouth all the way open, which means they're now stretching the masseter. So that's good. And what you'll find is that's really releasing the tension in the muscle, and you're stretching the muscle at the same time. Now the scalenes, I'm going to move into the scalenes. As you look in the trail guide for the body at the scalenes, you'll see you have the anterior, the lateral, and the posterior scalenes. Right this moment we're going to be doing the anterior scalenes. Start all the way down by the collarbone and use your middle finger and lay your finger along the collarbone and then just press in. And don't press in hard on this one because they'll really jump off the table on you in that one. So you just press and you hold it, and you'll get to know, as you experience more and more people, you'll get to know exactly how deep to go. So just press so that they feel it. What you're trying to do is find annoying discomfort as opposed to pain. And if there's pain, just back off. And all you have to do is back off just a fraction,